really humbled to be on this stage following so many great presenters and presentations over the last 3 days. Thank you to the organizers for allowing me to talk to you all about an herbal-based formula for hair restoration for patients with male pattern and female pattern hair loss. I had expected and planned to talk to you about the final results of a clinical trial, but for unforeseen circumstances, we had to make a switch. So I'm going to be talking to you about hair, about how in our practice, I work at Unger Medical in Manhattan, how we address hair loss, and also discuss the formula as well as a sneak peek into the clinical trial. So as mentioned in my amazing intro, I am an oculoplastic surgeon, ear restoration surgeon, but I'm also a herbalist, which helps me to really be able to speak to some of these ingredients. My relative disclosure that I need to mention is that I am an advisory consultant for HairSmart. If you didn't get a chance to see the booth and the formula in real life, then you can see Prerna, who is here afterwards. There she is. She and I can answer questions after if you have them, since the exhibit halls have closed. So why on the last day and the last session are we talking about hair? I will explain to you, actually able to show you why hair is important. But first, a poll for those who feel like participating. Can I see a raise of hand of anybody who has never had an issue with hair loss whatsoever in their entire lives? Oh, 2, 3. Okay, great. I think there would be more, but maybe evil looks would be given back and forth. The fact is, most people in their lives will have some sort of hair loss. 80% of men will have some sort of a noticeable hair loss by age 70, and 40% of women will have significant hair thinning in their lifetime, and that's not even mentioning the minor, moderate hair loss. Yet, less than 20% of patients or people who have hair loss actually seek treatment. And that's why I've called this a silent epidemic, because even though a lot of people have it, folks aren't really talking about it. Times are changing, but there is still a stigma behind losing your hair and also going in to do something about it. Half of our patients are women, and it's really sad when I see women come in and they actually feel guilty for coming in and doing something about it. And it's a real problem that I think we need to acknowledge for our patients. The most common cause of hair loss is androgenetic alopecia. It's the male pattern, female pattern hair loss, where the hair follicles form a sensitivity to androgens, the male hormone, and it leads to gradual thinning and eventually loss of a follicle altogether. Again, why does this matter? It affects so many people, and it can have profound effects on eroding confidence in people who are suffering from hair loss. It also affects identity, self-image, and can have a detrimental effect on mental health, including social anxiety and depression. We have patients in our office who will not leave the house without a hat on. There's one patient, he's a teenage boy, 17 years old. He wears a knit cap all year round, including the middle of summer, because he does not want to be ridiculed by his peers. We have colleagues whose patients have taken their own lives out of desperation related to their hair loss. So even though there are still some that think that doing something about your hair is solely vanity, it's truly not the case. Let's talk about the biology and the hair cycle. The anagen phase is the active growth phase lasting about 7 years. It's when the follicle is deeply rooted and it's producing a hair fiber. And the longer that hair follicle can stay in the anagen phase, the longer that hair will be. So when we're treating hair loss, we want the hair follicle to get into the anagen phase as fast as possible and to stay in it for as long as possible. There is a transitional catagen phase, and then the hair follicle goes into telogen. Many of you have heard of telogen effluvium, also known as shock loss. This is when the body goes through a metabolic stress and it actually shifts hairs from anagen to telogen. Normally, we have about 15% of our hairs in telogen phase. In the setting of metabolic stress, half of the hairs goes into telogen. And once the hair shifts into telogen, it's coming out. There's really not anything you can do. But at that point, patients are losing half of the hair on their head, and that's what breaks them in. Usually, we can trace it back to something happening 3 months prior. For example, a viral infection, general anesthesia, or psychological distress, loss of a loved one, or even a breakup. And so once that telogen hair falls out, anagen phase comes in. In fact, some of the medications that we use, and maybe some of you use for hair loss, you'll have patients come back saying that they have a shed after. It's mostly because that anagen phase is pushing that telogen hair out and causing a shed, but you just reassure them that their anagen hair is coming in. Let's see. Here's video. So dihydrotestosterone, DHT, is it's a byproduct of testosterone as a result of 5-alpha reductase. And this is the main culprit for androgenetic alopecia. What it does is it binds to the dermal papilla of the bulb of the hair and results in the hair forming a smaller and smaller hair shaft until the follicle is eventually lost. Other components to androgenetic alopecia honestly cannot be underestimated. That includes oxidative stress, which we've heard about over the last 3 days, that can accelerate cellular senescence, chronic microinflammation, which leads to fibrosis of the skin and permanent loss of the hair follicle, and that can be compounded by the overgrowth of fungi or bacteria in the setting of seborrheic dermatitis. Impaired circulation, of course, is going to contribute to hair loss, that the hair follicle can't get the oxygen and nutrients that it needs. And if you don't have the nutrients to actually create keratin synthesis, then no matter what you're doing for hair, you're not going to have the building blocks to be able to have true efficacy. So I'm going to go over quickly the landscape of hair restoration approach, starting with the most invasive, and that's hair transplantation. So our office specializes in this. This is one of our most advanced cases. It's best when there's prolonged, permanent, and advanced loss, where follicle is completely lost, or it's only producing a very small vellus hair that can't be reversed. And most of our patients, actually half of our patients are women, so they need even smaller area, but most patients will have the hair taken from just the back, the most permanent area of the hair, placed into the front where the patient wants to have the most density. And in a patient like this, a hair transplant really is the only way to get the density desired. So minimally invasive surgical, non-surgical treatments, some that you may be incorporating into your practice. I don't need to go into PRP, stem cell therapy, and exosomes. Many of you know them already. There are many other things that are used. There are devices that use laser, that use ultrasound waves, and use radio frequency to help stimulate hair. There's microneedling, and there's even mesotherapy. So a lot of treatments that could be used for minimally invasive type level. The non-invasive, we would consider the medications. Finasteride is a DHT blocker that started out in the prostate health space. It is a 5-alpha reductase inhibitor. It is a DHT blocker. DHT is the primary driver of androgenetic alopecia. Minoxidil started out as a blood pressure medication. It causes vasodilation, and it shortens that telogen resting phase and extends the anagen phase. In fact, when patients start taking oral or topical minoxidil, they'll notice an initial shed because that telogen phase has been shortened, anagen phase is coming in, and we just tell patients to hold on when your hair was coming. For spironolactone, commonly used for women for its anti-androgen effects. The things that limit the use of these pharmaceutical medications is the adverse events. Most of the men that I see really are hesitant to start finasteride because of the sexual side effects associated with the DHT blockers. And even though less than 4% of those patients had sexual side effects, it's still something that is prominent on a lot of men's minds, and it certainly does happen, and we've seen it. Minoxidil topical can cause scalp irritation. If you take it orally, it can cause hypertrichosis of the face and the body. And of course, spironolactone is a diuretic. It can cause diuresis and can also affect women's menstrual cycles. So other things that are adjunctive, which we like, is low-level laser therapy. And I just want to make clear that red light therapy is a very ambiguous way of describing what should be more specific. We prefer to use devices that have laser light diodes, still within that red light, or there's some in near infrared light, but the laser diodes give the collimated light that gives penetrance into the skin to the level of the stem cells and the level of the bulb. Whereas LED is more scattered light and doesn't always give you that same penetrance. So that is our preference. So we prefer the caps and devices that have laser over LED. Of course, the cosmetic and camouflage techniques give you instant gratification, but they are not treating the underlying cause. And oftentimes they're causing more harm because they're leading to traction alopecia on top of an androgenetic alopecia. But it's very tempting for patients to go this way, especially when they're desperate for getting more volume. What we prefer, scalp micropigmentation, or SMP. We have this offered in our office. This is a cosmetic superficial pigmentation that can give the illusion of density and also give immediate results, as seen in this before and after of a man that all he did was got the pigment there, and you can see that there's an illusion of density. It's temporary, so it's not a tattoo per se. And also, you can still give these patients the treatments that you would normally give them for the care of their hair loss. So yet there is still a gap on non-invasive solutions and things that patients can do for themselves. And there's only a small percentage of patients that we know actually seek surgery or these procedures or come in to see me or a dermatologist about their hair loss. So what do? Where do they go for information? They go where everybody goes, TikTok, right? And Instagram. And, Instagram, TikTok has many, Andy, if you can help me play all of these reels, I appreciate it. They have a lot of information and 1.5 million things to do about hair. And patients often come in wondering what they can do and what is actually real. And so what patients really want to know when they come to see us is what's real, what is safe, and what is going to work. And that's where this holistic hair restoration model comes in, where you don't just look at one aspect of hair. We like to look at the whole. And so for those of us who are treating hair loss with PRP, peptides, other treatments, if we're not also looking at inflammation of the body, inflammation on the scalp, addressing the patient's nutrition, and also looking at the scalp environment, then we're really doing our patients a disservice. And so this formula, which is based in Ayurvedic medicine, focuses on the whole body in addition to promoting hair. So that's where this comes in with Ayurveda as India's ancient system of holistic medicine, which focuses on harmony between the mind, the body, and the spirit. In Ayurveda, treatment supports the whole body, not just a single symptom or sign. And health is maintained by balancing the three doshas. And if you don't know what your dosha is, you can go to banyanbotanicals.com and you can do a questionnaire and you can find out what your dosha is and also what your imbalance is. And so we're always trying to get the doshas in balance in hair loss as well as in disease. The Vata dosha is air and space. Pitta is fire and water. And Kapha is earth and water. And how it relates to hair, Vata, that's excess, leads to dryness, brittleness of the skin as well as the hair, but also premature graying. Pitta, that's the fire, so inflammation and heat that leads to hair loss. Kapha is associated with cool, sluggish, thick, and you'd see oily production, a lot of oil production, and a sluggish circulation with an imbalance of kapha. And so we're going to talk about these key Ayurvedic botanicals that power the formula, but also want to say that it is important to honor and respect the ancient medical traditions that have been around for thousands of years, way before we've had any pharmaceutical drugs, before a randomized controlled clinical trials. Not every herb is going to have a randomized clinical trial behind it, but it has 3,000 to 5,000 years of tradition. And so it is important to honor that tradition. Many times a trial is done that supports a use that people knew about 3,000 years ago. So I'm going to explain both. We're going to start with amla, which is rich in vitamin C and polyphenols. In Ayurveda, it's known as rasayana. It's a rejuvenating elixir, an elixir of vitality. It nourishes ojas, which is the essence of vitality. And so it restores youthfulness from the inside out. It is cooling for pitta, and so strengthens the roots. And studies have shown recently that it actually has impact on inflammation, anti-inflammatory and neuroprotective activity. So again, current studies supporting something that has been well known for millennia. Bhringaraj is the king of hair. It rejuvenates the scalp and awakens dormant follicles. It's also rich in vitamin C and flavonoids. It is grounding for the vata that rises and cooling for the pitta. It has anti-inflammatory and antimicrobial effects, which can help balance the dysbiosis of the scalp. There are two Brahmis. In this formula, it's Bacopa, which is celebrated and known to nourish the mind and the nerves. It promotes clarity, calm, and overall vitality. Research has shown that it is a neurotropic and neuroprotective agent. It helps strengthen the hair and helps support hair health. Ashwagandha root. I know many people know ashwagandha. I want to pause on this to explain that the part of the plant that is used is very important. It's not all equivalent. In a lot of formulas, you will see ashwagandha leaf in a formula. When you look at the traditional use of ashwagandha across Asia and Africa, it is always the root that is used, very, very infrequently the leaf. In fact, the clinical trials that looked at ashwagandha that shows that it has an impact in the HPA axis to reduce cortisol is looking at the root. So when you look at ingredients of herbs, it's important to know which component of the herb you need for that effect. For example, the flower is what's supported for St. John's wort, for Tulsi or skullcap motherwort, it's the leaf. For barberry, it's the bark of the root. So it's very important. A lot of times things are confusing, and I think some of it, may be unintentional perhaps, but it's important to know the difference. Neem tree supports immune health, detoxifies the body. We know it as that antimicrobial, helps with supporting the scalp environment. Turmeric, sure everyone knows turmeric. What's important to keep in mind, a lot of concentration is on this active compound curcumin. There was a study done on mice that compared turmeric to turmeric without the curcumin. And guess what they found? Both groups did the same. The effects on inflammation, hepatoprotective effects, cardioprotective effects were exactly the same. So how can we presume to know the one thing that's making turmeric do what it does? It's impossible to know. The whole plant should be used and be considered rather than just a constituent, because there is wisdom again in the whole. Fenugreek, that is also very commonly used now. It's a warming, bitter, supports digestion, also good for women's hormone balancing, rich in polyphenols, which on day one we were reminded that has anti-inflammatory, antioxidant effects to help protect against cellular damage. Anantamol, a cooling blood purifier, something that helps round out the formula for overall health, but also helping with immunity, hormone balance, and nourishing the scalp. Things that are specific DHT blockers, of course, we all know salcomeddo, which is used as an anti-androgen for prostate health. A lot of things that are used in prostate health can be also used for anti-androgen effects for the hair. So a lot of those formulas can be used dually for hair. Pumpkin seed oil was found to inhibit 5-alpha reductase, which is what converts testosterone into DHT. In fact, in an animal study, showed that 10% pumpkin seed oil converted 75% of the hair follicles to the anagen phase in mice. Quite powerful. Stinging nettle. This is the root, which acts differently than stinging nettle leaf, which acts differently than stinging nettle seed. So again, you should know what you're looking for, which part of the plant gives you that. Stinging nettle root is commonly and widely used for prostate health, and it can have anti-inflammatory effects, but also can help with androgenetic alopecia. We all know green tea is a very potent antioxidant. It is also a 5-alpha reductase inhibitor. Hygeia bark, again, commonly used in urinary and prostate support. It is also shown to control DHT production and is part of a formula that helps reduce the DHT in the body for hair support. When we look more into topical things, ginger. When you look for ginger, cook with ginger, you don't get the ginger leaf, do you? You get the root. That's where the medicine is. Another example of that. Rosemary. Patients ask me all the time, does rosemary work? Yes, actually, there was a clinical trial that showed rosemary oil used over a 6-month period compared to minoxidil for 2% was equivalent. So that is a good alternative for patients who don't want or can't take minoxidil for whatever reason. And Tulsi, which is considered the queen of herbs, one of the most revered herbs in India. It's offered to the gods daily. It is a supreme adaptogen, and whether you've got hair loss or not, I recommend Tulsi for everybody daily. So let's look at the formula and a peek into what we're doing. So we're using advanced AI technology to analyze hair count and the sum of hairs, follicular count, for this multi-center clinical trial that's looking at the safety and efficacy of a botanical derived DHT blocker, serum, and vitamin in men and women over a 6-month period. This is a sneak peek into what we're seeing, some preliminary information. This is hair metrics measured. You can see that there was a dot there. It's a temporary tattoo. This is how we can measure the same spot at every visit, so we can get consistency in what we're analyzing. And the number at the bottom shows the total hair count. So this patient, looking across 3 areas of their hair, of their head, the frontal, mid-scalp, and anterior vertex, showed an increase of 11% in their hair count using this system and formula. This is another patient that had 14.5% increase in their mid-scalp hair count and over 6 months. This is another 6-month patient who had an 11% mean increase in their hair count over the 6-month period of time. So the numbers that you should look at is the gray bar. The printout shows the different caliber of hair and measuring that. Of course, we want to have a higher number of the green, the terminal robust hairs, but you ask someone with hair loss, they'll take any hair that would increase. So overall hair count is what we look at. And so as this ongoing clinical trial is continuing, hopefully in the next year, and when we see each other again, we can talk about the final results. But so far, preliminary results are promising. And one thing I would like you to take away is that no matter how you are choosing to treat patients or even yourself with hair loss, consider the whole. And formulas like this do address the whole person. And because there are many things that contribute to hair loss, stress contributes to hair loss, and hair loss contributes to stress. The inflammation needs to be addressed, the nutritive side, as I mentioned. And so if these things are not really addressed, you will get some effects, but not as much as you could with supporting the patient in a holistic approach. So I'd like to thank you for being here on the last day of this conference. Thank you to A4M. And please let me know if you have any questions. Safe travels to all of you back home. Thank you.